Good evening, everyone. It's December 11th, 2019. This is Natural Childbirth 101, and it's our weekly live Wednesday nights at 7 o'clock. And I just want to welcome everyone. It's always exciting to see everyone come on in and join us. And I've seen lots of new people coming along for this particular topic. And I touched on this topic about a year ago and realized that it's time to expand on it and to do it again. So welcome everyone. So I'm Kaleem Joy. I'm a licensed midwife here in the Sacramento, California area. And I'm also a certified pediatric massage therapist and a CPM, which is National Midwifery. And I have a wonderful opportunity to share with you tonight about supplements and nutrition as it pertains to pregnancy, birth, your baby, and postpartum. And the reason I bring this topic back up again is because I have been asked by some of the followers to discuss, what do we as midwives do? Well, first I want to let you know that not all midwives are the same, but we generally have a lot of similarities. In our practice, we have learned through the years of working and serving hundreds and hundreds of families what works. And so we've kept doing it because we find if it's working, then why change it, right? So I wanted to bring that to you tonight. What do midwives do? I do want to give a little disclaimer because a lot of the things that we're going to be talking about tonight, some of you may have certain health histories, or you may have certain things that are going on in your individual pregnancies that you need to take the information and you need to decide whether this applies best to your situation. Because as a midwife who serves home birth families, thanks. Ashley, that's so cute. I'm always looking and going, I don't know, what am I going to do with it next? Anyway, she said she likes my haircut. So I have an opportunity to do this disclaimer with you to remind you that each of you are individuals. Each of you has your own health history. And as a midwife who serves a population who is low risk and who is considered normal and within those parameters, I can use the things that I'm going to tell you tonight. If you have certain situations in your health history or your pregnancy, you need to evaluate if any of these may or may not apply to you. The ones that I'm telling you are what I tell families when they come for their first visit. These are the supplements that we recommend, and here are the nutritional guidances. So I hope you're ready. I hope you've got your listening ears on. Now, one thing I will tell you is there's a whole lot that I'm going to cover about these. So there's a lot of names and quantities and what they do and etc. And you're all going to be like, oh man, I wish that I had written that down, or I wish that she'd do something. Okay, so if you will send me at either my email or, let's see, I think this one is this way, okay, because Instagram and Facebook are different. It is kaleemjoymidwife@gmail.com, okay? So I'm going to do that for the Instagram people, but yours I think is backwards. Did I do it right? kaleemjoymidwife@gmail.com. I had to type it in backwards. And I'm happy to show that to you again as we go along. If you will email me your email, and I can then send you a printout of everything that we're going to talk about tonight, or hopefully talk about, and there are quantities, very brief things about them, but at least you'd have a list, so you don't have to try and scream through a list while you're listening tonight, okay? But you just have to send me your email. All right. So the first thing that I want to start with is when you want to have a healthy pregnancy, a great birth, a good postpartum and a nice healthy baby, the very, very, very basic thing you have to start with is good nutrition, right? So good nutrition means lots of whole foods. What does whole foods mean? It means that you know what they are. You know that a carrot is a carrot and an apple is an apple, and you eat lots of greens because they're nice and fresh, hopefully organic. If you're going to eat meat, that you know that it's a chicken, or you know that it's beef, or you know that it's fish and it hasn't been highly processed, such as lunch meats, or that they come in packages. Most of your packages are not what I consider whole foods. So they need to come from nature, and that's from the ground or from the animals, if that's part of your philosophy, okay? And when you do that, you will find that your nutrition is by far accelerated. Now, this baby that would grow inside you or your friends or your family or anybody that you're going to share this with, these babies need lots and lots of whole foods because they have all these little teeny little micronutrients, right? And a baby that's tiny in the tummy is looking for micronutrients. They're like little hummingbirds. They're buzzing here and buzzing there and getting all these little tiny micronutrients. So they're looking for a good variety of things. So that's one thing to keep in mind, is that you have a really good variety. So that brings us to colorful foods. Now, at this time of year, we have to change a little bit of how those colorful foods come easily, because going to the produce aisle, we have an abundance of anything that can be grown. Going to farmer's market, it's seasonal, right? So we're looking at, in the winter time, a lot more squashes and our apples and our oranges and things of that nature. In the summertime, we have more abundance of different fruits, a little more abundance of different vegetables, but we still have access to a wide variety. Now, you may be living in some place in the United States or in another country where fresh food is not as easy to come by. So you have to buy the best quality and make sure you eat it well, never let it go spoiled in the fridge, and really make sure that you get that good nutrition. There's also sometimes like dried containers of various juices of foods. That might be the next substitute to being able to get a lot of those raw nutrients. So you want to have a good nutrition. The other thing is protein. No matter what kind of eater you are, whether you're a meat eater or just fish or just eggs and dairy, or whether you're a complete vegan, it doesn't really matter. You have to focus on that protein. And you need 80 to 100 grams of protein every day, because that's your building blocks. That's the baby's building blocks. That's how you build all the excess blood in your body. And we've talked about this numerous times. And how the baby can build their body with all of the essential amino acids that you need. So you have to really make sure that you're educating yourself well, especially if you're more of a ovo-lacto or a vegan, and vegetarian, because you want to make sure that you're getting your proteins appropriately. And I know, having been a midwife, I've worked with a lot of families, and sometimes someone chooses to become vegan because, I'm nervous, I've been eating bad this pregnancy. You know what? Today is a new day and tomorrow is a new day, and what's bad for you may not be for someone else. So there's a lot of variabilities with this. And I want to remind you of that, because one person may say to me, I just haven't been able to get my organic in lately, or I've just not felt like I wanted to eat as many salads, whereas that to them might feel like, oh, that's been bad. And another person says, I finally cut down on not drinking 6 Pepsis a day. I only drink 1. And for them, they're improving, all right? So what I'm suggesting to you is begin really nourishing you, nourishing that body, nourishing the baby, nourishing the pregnancy, getting ready for the birth, and give you and the baby as much nutrients as possible to be able to feel good, grow well, and have a positive postpartum as well. Because when your body is a bit depleted, sometimes the postpartum can be harder because you're doing a lot of healing and rebalancing of things. All right, so getting those whole foods in, making sure that your protein is there so that your body, your baby, your excess blood, because getting that excess blood is what keeps that blood pressure under control and really is helping to, oh, okay, I will tell you what's on the wall behind me in just a minute. Really helping you to keep that blood pressure under control, which means less interventions, which means less complications, which means less problems in the birth and afterwards, right? It's a simplicity. It's protein, 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 but lots of good quality protein. And that means your Greek yogurts, that means cottage cheese, your meat, fish, chicken, eggs, beans, legumes, your different, yeah, my brain's going. Try to keep minimum on the soy, all right? So look at what your proteins are. Try and get 80 to 100 grams a day to be able to really build that. All right, so the wall behind me, all of these are all the babies that we have done. I'll try and, I can't really tip it at this point, but over the years, each strand is, this is interesting, each strand is a year that we've been working together, and we're on our 21st year, so our practice has finally become of age. And each one of them on there is one of the babies that we had the privilege of walking the journey with them as they came earthside. And each of them has either a water bead or a land bead, and some bead that represents their family, the names of the babies, their birth dates, and there is also a purple bead if we had to transfer a family in. And I'm happy to answer more about that later, but remind me, okay? All right, on coffee during pregnancy. So coffee during pregnancy, the baby does get the coffee in the same way that they do when they're nursing. And it takes a baby at least 8 hours to get rid of caffeine. So it's really best either to keep it, down to a half a cup a day. I can't say that decaf is necessarily much better, but the less you can have, the better things will be. And especially when you're nursing, if you have a cup of coffee in the morning, the baby's going to be a little more awake during the day. That's great. It can irritate their tummies. Coffee and caffeine can be challenging on your hormones too. So do just, keep it to a minimum if you can. Okay, I get that sometimes that's the only way you can get your engine running in the morning. I'm not a coffee drinker, so I don't really understand that in the same way that others might. But I do have compassion on the fact that sometimes that engine is hard to get going. All right. So let's see, extras you'd recommend for twin pregnancies. Yes, you need to get at least 100 to 120 grams of protein with a twin pregnancy. So that's a great question, because you've got to produce almost double your blood volume in order to support both babies. And the more you can have a good nutrition, the more you build that blood volume, the more that you eat. And the thing that we've said to mamas who are expecting twins, you need to eat, and then you need to eat, and then you need to eat more, and you need to eat when you don't want to eat. And when you can do that, and you can gain at least 50 pounds, pregnancies do better, the babies grow well, they're nice and healthy, they stay in there until term, or within a few weeks of term, and you find that you have a much better delivery and an easier postpartum. All right, so with nutrition, we go to the protein, and then as we move from having those colorful foods, lots of variety, lots of good healthy protein, we move into why have supplements. Supplements are something that we have seen that have helped to fill in certain gaps that seem to be pretty universal, and understanding that we deal with the population that we're working with here. But I do feel really comfortable with a general population that these are relatively good supplements to take to heart. All right, so first one that most of you are familiar with is a prenatal vitamin. Why in the heck, if you're eating good, do you need a prenatal vitamin? Well, some people may not, okay? They may have a diet that is so good at its variety, has all the nutrients that they need, that they may not. Well, as most of you know, some days are just not as good as others. Sometimes our tummies may not feel as well, sometimes we're too tired to cook, or the various things that go on. And prenatal vitamins were started in order to fill in gaps that might be missing from that day-to-day nutrition. And vitamins are definitely one. Oh, I've done it again. Hang in there. I got to figure out how to turn me back around. Oop. Is that it? No, go away. There's something that happens when I go to push where all of you are, and no, it's not what I want. Somebody do my... Oh, this is so much fun. All right, somebody help me figure out how to turn the camera back around, because it's not... Oh, wait, there it is. I did this once before. There we go. Sorry, I'm back. I don't know what button it happens, but it does get pushed. So when you look at supplements and prenatal vitamins, they have a lot of B vitamins in them, and thank you. It was this little button up at the top of the screen. Yes. Okay, so someone had preeclampsia at 37 and a half weeks with her first. How do I not get it this time in any supplements? Yes, and we are going to go over that. So protein is one of your biggest things that you have to eat. Anytime, breakfast, lunch, dinner, and snacks, you should have some type of a protein. And that's including nut butters and nuts, and all the other things that I had mentioned a few minutes ago. So when you can eat that protein and your blood volume doubles, your blood pressure does better, but I am going to give you some supplements that we have found that have been helpful with that. Your prenatal vitamins have a lot of B vitamins in them to help with your blood volume, to help with the nervous system. They have iron, they have calcium, magnesium, they have vitamin D3 now, and many of them have other things. One important aspect is for you to remember, buy a whole food prenatal vitamin. Do not get them at the drugstore usually. You need to either order them online or get them from a health food store. Now, one brand that I really like is called Innate Response. Theirs is very whole food. I find that women birth givers do really well on their tummies with it, and they don't find that they have such an aversion to it. Because many of the prenatal vitamins, because they are so high in B vitamins, sometimes the smell of them can cause you to struggle a little bit. So taking them at night helps. Okay? All right. So going from prenatal vitamins, I do like Code Raw. There's several different ones that are whole foods. And I don't mean whole foods as in the store. I mean whole foods as in they're made from whole food and they're not highly processed, because that way your body can absorb them and do well with them. So that's really well, okay? All right, methylfolate. I've talked about methylfolate in the past. Methylfolate, folate versus folic acid. Many of the prenatal vitamins are now putting folate in them instead of folic acid, which is a synthetic. Folate is the natural, and even better is having methylfolate. So you want to make sure that you have methylfolate 800 to 1,000 micrograms a day, because that helps with cell division. And as your blood is having to be made, you need to be able to do cell division, right? The other thing is your baby. Your baby, from the moment they're conceived, is doing cell division. If you've been on birth control pills, your body is lower in folate. So it's really important that you take and boost up your body getting ready for pregnancy, or when you get pregnant, or if you are pregnant, that you keep that folate really in there, helping your body to do cell division. Cell division is real important. To recommend a brand, again, go to the health food stores, use one of the brands. It's not as important to have a particular brand, if you will. I know the Now brand, Source Naturals. There's so many good ones out there for something like that, because that one is more plentiful in being able to find it. But just don't go to the drugstores, generally not to the grocery stores, unless you have a grocery store that has a pretty good health section to it, okay? So you want that cell division. That cell division is really helpful for midline issues such as tongue ties, cleft palates, heart defects, umbilical hernias, things that go on for little boys with penis and where the meatus happens to be. So it's real important for midline because it wants things to subdivide and come together appropriately. So make sure you're taking lots of those. Do you recommend choline? And do you recommend high doses of vitamin C after 20 weeks? Heard fermented foods after 20 weeks. Oh, I love fermented foods. Those are so good for your system. And as far as vitamin C, we usually recommend 500 to 1,000 milligrams a day because that helps with the absorption of iron as well as calcium. But if you start taking like 3,000 to 5,000 a day, often it can make your bowels a little bit loose. But the other thing that is, nobody's exactly sure, but we do see a tendency that placentas like to get stickier. In other words, they may not want to come out as easily if you have too much vitamin C, and part of that is that it also helps with the formation of collagen, so the placenta may be forming too much of an attachment when it does that. So 500 to 1,000. If you get a cold and you take 2,000 to 5,000 for a couple of days, that's fine, but not continuing. Like I said, I love fermented foods. Whether that's tempeh, kombucha. I know a lot of families will make fermented vegetables. Those are just so full of not only nutrients, but probiotics, prebiotics. And in our day and age, the gut is in such need of support and help. So that's coming from me. Again, the disclaimer is you have to make and decide those things for yourself. If I have folate in my prenatal vitamin, do I need additional? So look in there and make sure that there's 800 to 1,000 micrograms. If there is, then you don't need an additional. If there isn't, then try and just buy one that will help to equal it up. Are there supplements that may help with varicose veins? Okay, vitamin C does help. Rutin is another supplement that you can buy, pretty standard out there. I like also anything that is antioxidant. That does help. But my favorite one is CoQ10 enzyme. CO, capital Q, number 10, enzyme. That one is not on this list. I will try and remember it. For those of you that joined me after the beginning, I do have a list. If you send me your email and you want this list of everything that I'm talking about tonight, I will send you the list. So CoQ10 enzyme, that is something that I absolutely love for helping with varicose veins because varicose veins need more elasticity, and that elasticity is helped by having CoQ10 enzyme, vitamin C, and protein to create collagen in the body. It doesn't hurt that your skin gets a little bit of that too, nice collagen. So that's a lovely one. It usually helps with energy. Very beneficial to a pregnancy, and there's next to no, you'd have to take hundreds and hundreds of thousands of milligrams in order for it to even come close to even trying to be toxic. So you can take quite a bit of it, and I usually recommend 200 to 400 milligrams of CoQ10 daily. The other thing is putting some arnica cream on those varicose veins. Those help as well. Do you think cell salts would stand in place of a lot of supplements? I have used cell salts and I think that they are beneficial. I'm not sure I could give you an opinion if they were a good substitute because I don't have that relationship with the cell salts. I have a great relationship with the whole foods that I recommend. So that is something that you're going to have to do more research with. All right, let's see. So let's keep going down the list. So magnesium. Magnesium is another supplement that hormones tend to love during pregnancy. So 400 milligrams of magnesium every night before you go to bed will help you sleep better, keep you from getting leg cramps, unless the leg cramps are from muscle tension up in your hips. It usually helps your bowels to be a little bit more coming regularly, and it's helpful in the calcium magnesium D3 process. So I like magnesium for leg cramps and constipation. Let's see, where are we going? Calcium. So calcium, you want it for good bone health and for their teeth development, but it also happens to be part of your blood clotting. There's part of that element that works with that, and again, it works with your magnesium. You know, your body is something that has so much, nothing works singularly on its own. It always has an interdependency that works with other things. And that's why I love that interdependency, but we often have certain deficiencies that we see more in our day-to-day than we did perhaps 50 or 100 years ago. And that being said, we had the Great Depression, so then everybody was challenged by nutrition altogether, right, in the early 20s. All right, vitamin D3. This one is so helpful. Vitamin D3 with K1 and K2. Now, vitamin D3, it's a vitamin. It also affects a lot in hormone, but many people will find that their energy levels improve. The baby's energy levels improve. Their skin rashes go away. Hair loss subsides. I've had people lose their eyebrows and their eyebrows come back again because their body was so deficient in D3 that they weren't able to keep up with it. Now, for those of you that say, but I get out in the sun because I live, you know, in Hawaii or someplace where I can get a lot of sun, that's great. What we are hearing from the researchers is that our ozone level doesn't allow enough of it through to really benefit us. Now, maybe if you live in Hawaii and you're out swimming in the water a lot and you get a lot of D3, maybe you don't need to supplement with that. But I am sharing with you, those are the symptoms of a D3 deficiency. We do see them in children a lot and in the newborns. It's hard to tell an actual newborn. As the baby gets a little bit older, you will see symptoms in them. And it is recommended that a nursing mother take at least 1,200 units. We recommend 2,000 to 5,000 units to really get that body stored back up again. And the reason you want it with K1 and K2 is that K1 and K2 help that D3 to help tell the body where the calcium needs to go, which is your bones and your teeth, rather than in your arteries or your gallbladder or places where it's not going to serve you well, okay? Let's see. I don't know a lot about probiotics. Would you recommend taking throughout pregnancy? I am going to cover that. Thank you for asking. Yay for arnica. Yes, absolutely. Hypnobirthing. Yes. What type of magnesium? Magnesium citrate is usually the one that you'll find, and it does a really lovely job. Okay, let me go back here. All right, so we're going to keep going and answering those lovely questions. I love that you guys bring me questions. It is so much fun. Dandelion. Okay, this is the most wonderful all-time favorite for me is dandelion. And dandelion is, yes, just like what you think of it as out in your yard. Now, dandelion that's been prepared for you has been prepared to make sure it has no pesticides or anything else in it. So it's been grown specifically for ingestion. So be careful about just going out in your yard and picking dandelion if you don't know, what's been in the yard, okay? Anyway, using dandelion greens to eat, but especially taking capsules of root or leaf. Often root is what you can find, dandelion root. If you can find leaf or a leaf and root combo, that is awesome. So here's what we do. We ask families to use dandelion, and they take 1 capsule for every 2 months they are pregnant. So by the time that they're ready for birth, they're taking approximately 4 or 5 capsules per day. And what it does is it balances sodium potassium, so we see that any of that little swelling that comes up seems to stay to a very low minimum. We find that it really helps keep that blood pressure in a happier mode. And part of that is because it's a liver nourisher. So it's telling your liver, do your job, keep filtering all those excess hormones that the body is making to keep that pregnancy going good. And you're filtering all of that excess blood, and especially if you're carrying twins, we kind of up that to between anywhere up to 8 to even 10 or 12 dandelion a day, because we find that that really helps that liver to want to be happy and do its job well. And when the liver's happy and doing its job well, the blood volume is growing, the placenta's happy, you find you have a great pregnancy, you're not having complications, and that means you can go on to plan to have a great birth and an easier postpartum. Now, I like to think that if you're taking something that's nourishing your liver, because that's what some of its specifics are, I'd like to think that it helps make the baby's liver stronger and healthier too. And maybe they won't get as much jaundice or something. I don't have any research on that one. It's just kind of a hypothesis for me, all right? But I love dandelion. And when we have blood pressures that start to go up, then we up the dandelion, and we make sure magnesium's on board to relax the blood vessels so that they will accommodate the extra blood. We say eat lots more protein so that the blood volume can grow. And we say if it is a marginal that's climbing up into there, we also add a supplement called, ready for this, passion flower. So passion flower is a wonderful herb that really seems to help with certain kinds of blood pressure that are elevating. And it also helps with anxiety. So if you're one that's really prone to anxiety, but maybe your blood pressure isn't so much of an issue, you can take that. If your blood pressure has been a bit of an issue, taking the dandelion, the magnesium, and the passion flower seems to really be a support, along with good nutrition, right, to help keep this pregnancy on what we consider a low risk or a normal trajectory. So one of you asked about preeclampsia and how do you not get it this time. This is how we would recommend to someone to keep that away. All right. All right. So fish oil. Fish oil is something that it nourishes the brain. It's really helpful because fish oil and DHA and many of your prenatals or supplements will have what's called DHA in there. It's a big long word for the acid that's in there, okay? And being able to have a fish oil really does support brain growth and development. And I've had people give it to newborns on up if we've had any concerns with whether their neural system is doing okay. They start taking some of that fish oil to really nurture that brain development. So that's something that's really helpful and supportive. Let's see, we've got another one on this side. Love reviewing this topic even 3 years. Oh, you're so sweet. Thank you, Jennifer. I do too. This is a nutshell of what midwives, how we keep you healthy, or what we give you, because we can't keep you healthy. That's your job. To helping you keep low risk so that you can have a baby at home without complications, being able to have a positive experience postpartum as well as your baby doing well, right? So I'm giving you the tricks of the trade of what all of these behind me, which is hundreds of these up here. I can't really show them all to you, but you know, maybe I'll take you on a tour one of these times up there of how we do that. All right, alfalfa. So starting at 28 weeks, we have our families start taking alfalfa. Yes, it's the same one that the cows have been grazing on out in the field. So why? Because alfalfa happens to build vitamin K in your body. So when we have a good vitamin K store, then when you birth and the placenta comes out, we find that we keep the bleeding to a nice minimum. And that also helps be able to keep those things out of the way, right? Those complications down. Including not pulling a placenta out before the placenta starts to birth on its own. Because when you do that, you do increase the risk of bleeding, including cutting a cord before the baby has completely finished with the placenta, which in my opinion, a baby is not done with its placenta until this placenta is out of your body. Then I know for sure this baby is, at least on a physical level, has taken care of its transition and no longer is using it for anything. It may on a spiritual level not be ready to let go of it, but on a physical level, the baby says, I'm here now, I've got all of my transition happened in my heart and in my kidneys and in my lungs, that my placenta no longer has to support me in anything anymore. So you want to be sure that you have that so that placenta isn't taken out too soon. So alfalfa, and we usually recommend 2 to 4 capsules once a day starting at 28 weeks. Now, maybe you're somebody that gets hay fever with alfalfa. Well, then that's one of those things you're going to say, I shouldn't take that then, right? So don't expect to, that's why I say you have to do your own individual. Maybe you have a clotting factor. Maybe you have liter 5, then you don't want to take alfalfa because you don't want to build that clotting factor, okay? So that's where I'm saying again, you have to take the things that I'm saying, look at your own situation and say, is this what's appropriate for me? Because I'm not your midwife. Well, some of you maybe I have been, but I'm not all of your midwives. And so I can't determine exactly for you what's best for your health. But I can tell you this is what we use on a continuous basis. Okay? Okay, let me go down and see where our questions are going here. Can you recommend any more natural approaches to handling acne while pregnancy, trying to conceive? Doctors recommended medication and antibiotics that aren't safe for trying to conceive. Okay, so acne prior to conception. Yeah, your liver. I would say really focus on having some good raw juices like carrots and celery and cucumbers and apple, and maybe throw a lemon or a lime if you have a juicer, or if you can find somebody who's got a juicer. What I do is I juice all that up and I put them in pint jars, fill them to the brim, make sure none of the little foam is on it, stick a canning lid on it, and I put it in the fridge. And that way you can have a pint or a half a pint once a day for 3 or 4 days. Do that in your weeks and you'll find that that'll start clearing up a lot better. Hormone-wise, you might try the D3. A lot of times that helps with it. I agree with you to start antibiotics to try and clear up acne is like messing with the immune system. And we know that sometimes the acne is the liver and the gut. So if we get the gut and the liver happy, then often the acne will start to settle down. We're going to talk more about the gut, so stay tuned on that one. But the dandelion you could start taking now, and the fresh juices I think are super helpful. All right, so probiotics. Now that we're going to talk about that gut issue. Hair loss, thinning after birth. Yeah, get on, when it comes to hair loss and thinning after birth, get on the D3 with the K1, K2. You're going to lose some because some things happen, but the other thing you could add would be some kelp, and you can get that in, magnesium bisglycinate. Interesting. Okay, so the vitamin D3, I would take 5,000 units a day with the K1 and K2 added to it. And I would have, make sure you have your thyroid checked to make sure there's not a problem going on with your thyroid as it rebalances to being in the postpartum period. Some people have a challenge with that. You can nourish that thyroid by adding kelp. You can get 1 or 2 capsules of kelp in your diet each day. As well as you can get a 1 or 2% iodine, and you can take 1 to 3 drops of iodine a day to nourish that, that thyroid that's going on. Out of curiosity, did you have any trouble with milk supply? So I'll see if that answer comes up while we go forward on probiotics. All right, so probiotics. If you don't know what they are or enough about them, it's a good time. It's a good time to start learning, because your gut and your baby's gut has a great need to be able to be nurtured, and make sure that they get that, because for life we're learning that these. We're learning that the gut and the microbiome of a newborn is essential for avoiding not only allergies, but lifelong health problems, from diabetes to muscular sclerosis to all kinds of things that can get set up from this microbiome, as well as their autoimmunes, the eczemas and things of this nature. So probiotics, in your gut you have good bacteria. Some you have bad bacteria, but the good bacteria is in there to help keep the bad bacteria away. And that good bacteria needs certain things to be able to thrive and survive. So during pregnancy, we suggest taking a probiotic, and one of them that has a benefit is called Femdophilus. And the reason being is that it has two particular strains that often are not in a lot of the other probiotics, and those two particular strains seem to have a great effect on what's called group beta strep. And for those of you who have been pregnant, or maybe this is your first pregnancy, at around 35 weeks they will want to test vaginally and rectally to see if you're colonizing group beta strep. And it's not an active infection, it's that you're colonizing more of them, because in and on our bodies we have staph, strep, and all these things, but they live, in harmony because we have good bacteria that keep it under control. When that good bacteria is not able to keep that group beta strep under control in the bowels, because of the proximity of the bowel and the vagina, there seems to be some passing that then starts to populate the vaginal area with group beta strep, which then sets you up, if you're in a hospital setting for sure. Midwifery practices, we have a little bit different way that we handle it for the potential of needing antibiotics in labor. Now, when you're getting antibiotics in labor, you're getting them through IV, which means you are getting a sterilization of bacteria both in your gut and your body, and the baby is getting a sterilization. So that means that that microbiome that baby has to pick up from you when they're being born isn't going to be there. And that means the baby is going to have to figure out how to populate that, and many babies don't. So they run into a lot of digestive problems. And I cannot tell you how many kids I see with reflux and gut issues. It's amazing. Now, I know they come to me because they have that, but it's amazing how many there are. So, taking a probiotic and making sure that you eat some good fermented foods like your yogurts, like the kombucha, like whatever fermented foods that you happen to enjoy, these are really helpful for your gut. The more your gut is doing that, the better you're going to pass that along to your baby when your baby is born. For those of you that end up with cesarean sections, there's what's called seeding. If you don't know about it yet, look it up. Because seeding means that they take a gauze 4x4, they put it up in your vagina to let it get nice and juicy and really saturate with your vaginal secretions. After the baby comes out, you wipe the baby. Now, this may sound weird, but it's what the baby should do as it's coming through you. They wipe the baby's face, their eyes, their nose, their mouth, and their entire bodies with this seeding. Now, the staff doesn't have to do that. You can do that, all right? But being able to do that helps to seed, or helps that microbiome to be on the baby, and then you don't bathe the baby for at least a few days so that the baby can begin to start picking up this bacteria. You have to not have been sterilized from it to make it as effective as possible, meaning that you've had lots of antibiotics during the labor, okay? But doing it is still better than not doing it. But you can look it up. It's called seeding with a cesarean section. All right, so these probiotics are there to make sure that it's a prevention of group beta strep and a prevention of having to have antibiotics in labor, which then can precipitate any number of things, from having thrush afterwards on your nipples, thrush in the baby's mouth, diaper rashes, the baby's microbiome not being as good, and the setup for lifelong health issues. So taking the probiotics is a really big preventative. And that's really the thing for me, is sharing all of this with you. These are preventative measures. Now, one thing I know a lot of you are hearing is, my goodness, Colleen, that's a lot of supplements. You're right. It is. I know, but it's what's worked. And we have such incredible statistics that I just can't argue with what we're doing. Does every single woman need everything that's on our list? Probably not. And some of them choose to say, you know, look, this is the way my diet is, and they say, I'm not comfortable with taking this. Great. It does sound like your diet is taking care of that. You probably don't need that. But sometimes I have families, I don't really take supplements. Okay. And then something shows up and I'm like, are you taking the dandelion? No. Well, it might be a good idea to start taking it, because if we don't get the blood pressure under control, then we may not have an option to continue, right? So for me, it's really about prevention. And remember that supplements are food. They're not medicine in the way that traditional drugs are. This is food. When you take a capsule of dandelion, this is not a medicine like a drug. This is taking a bunch of dandelion, dehydrating it, and putting it in a capsule. You're eating more food, all right? And that's the thing to remind yourself. All right, let's see. Let's go to some of our questions and see how we do. Supplements to help with nausea. Yeah, the beginning, and I think I did a live on this, oh gosh, maybe a month or so ago, where I talked about morning sickness. So you might want to go back and look at that one as well. But what I would say is nibble, 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 tiny little amounts of things. Never get hungry, never get thirsty. Drink, drink, drink to keep your body hydrated. I do find that using Nux Vomica homeopathic and Bryonia and Sepia seem to help. But again, it's not across the board. Every birth giver seems to have her own story as far as what her nausea is. Some, it's just eating and drinking, and some, my throat's getting dry, girls. And for some, taking the homeopathics will help her balance, which helps keep it under control. For some, it's wearing the C-bands, which you can get online or at some of the sporting goods stores for acupressure. For some, it's also taking what's called Unisom, which is an over-the-counter sleep medication. And sometimes that's the benefit is taking that along with vitamin B6. Taking 25 milligrams of vitamin B6 up to 200 milligrams total in a day. And if you're going to take the Unisom, take a B6 with it. Often that may be the only way to get through not becoming dehydrated and needing to go in for IVs. So there's a toss-up on that one, that's better than going in and getting IVs and being on medications and then getting dehydrated and having to do it again, okay? All right, let's see. I've got lots more supplements to go over with you. And, okay, we're getting there. So let's see, where are we at? Passion flower, I told you about. All right, as we go through the pregnancy, at 28 weeks, your blood volume goes through its maximizing, but your red blood cells are at their lowest, and then they'll climb getting ready for birth. So often your iron or your hemoglobin can be low around 28 weeks, and you may feel pretty worn out. Well, low means that it gets down around 10. So if you ask your care provider, what is my hemoglobin at 28 weeks? And they say, well, it's 10, then you know that that's why you feel a little winded, why you feel tired, and you probably need some help with boosting. So the supplement that we use is Nature's Plus Chewable Iron. Not easy to find in most of the stores, but online you can find it. We love that one. Floradex is another one, but I find it's quite expensive. You have to take a lot of it, and a lot of our families would prefer the flavor of the chewable iron. And I find cost-wise, because that one in today, you know, in 2019, runs about $12 a bottle. Whereas Floradex runs $25 a bottle, and I don't feel like it does any better than the chewable iron. There's also swallowable from Nature's Plus as well, so that one is equally as good. It has more iron in it. Nature's Plus also does one called Hemaplex. That one is excellent if you're really trying to kick that iron level up because it's low, all right? But do make sure if you're on a vegan or a vegetarian diet that you're taking extra B12, 1,000 micrograms a day of B12, because you need that blood volume, you know, and that methylfolate, right? You have to have the elements to make the elements. So you want to make sure that you're getting those in your foods or in supplements if you need to. All right, so as we go through going to about 35 weeks, we usually recommend a supplement called Evening Primrose Oil. And we recommend about 1,300 milligrams. 1,300 just happens to be most of the time that's what it comes in. So somewhere between 12, 13, 14. It's not an exact science on that one. And the reason that we have them take it is, one, it is a support to brain growth and development, but mostly it encourages prostaglandins in the body. And so if you're one that has a tendency to go overdue or it's a first baby, then taking Evening Primrose starting at 35 weeks will help with ripening. The other thing that I find absolutely across the board is that it makes cervixes want to be stretchy. And that means in labor that the cervix wants to open, it wants to be stretchy, and it's not resistant to anything. So we sometimes will even squirt Evening Primrose Oil right straight up in there if the membranes are intact. If we have a cervix during labor that seems to be just a little bit a little bit rigid, or maybe you're one that has had an abnormal PAP and you've had a LEEP procedure, or you've had cryo on your cervix, meaning it's been frozen, or you've had something done to your cervix that could precipitate you having scar tissue. Squirting some Evening Primrose up in there to help soften that is going to make the labor better. And so we find that really seems to help. So that's at 35 weeks, not before. If you're prone to earlier babies, wait until you're 37 weeks when you know you have basically a term baby before you were to do something like that. It does seem to ripen their lungs up as well. So early babies benefit by it, but you don't want to take it because you don't want to precipitate an early baby. So 35 weeks if things are normal, 37 weeks if you're prone to earlier babies. Homeopathics. For those of you who might want homeopathics in preparation for labor, it is something that we give as an option to families if they want to use homeopathics. The general ones are what's called Semisafuga, which is equivalent to black cohosh in a tincture, Calophyllum, which is equivalent to blue cohosh in a tincture, and aconite. Those are the three general ones that usually are like that. Now, I have shown you before, but my favorite is actually called Berthies, and it's made by King Bio. And I like Berthies because it's a combination of homeopathics that has it's a little squirt, tastes just like water, and I find that it has a nice rounded amount so that you don't have to pick and choose necessarily and figure out the exact right remedies that are for you. Now, if you're somebody who really focuses on homeopathy and you have a homeopathist, they are going to give you your own constitutional remedies. But this is for the general public, and Berthies would be general, and in my opinion is good for anybody. I don't care what your health history is, okay? You can use it getting ready for birth as a just daily preparation once or twice a day. But don't start it till 37 weeks, just in case you're really sensitive to things. All right, let's see what we've got here. So helpful. Thank you. 7 weeks pregnant and have felt overwhelmed with supplementation, and this is very helpful. So I want you to know that when you're in the early weeks, under 12 weeks, the methylfolate, all right, and if you can get a prenatal down, are the most important. Once you're over 12 weeks and your tummy settles down, then you can start taking some of these other things. But it's hard sometimes to get anything down when your tummy's not feeling well. And even prenatals, once in a while, it's just hard to get them down. But if you do it when you go to bed at night, sometimes that helps. And especially if they're whole foods, often they'll settle in a little bit better. So hopefully that does help. But let's see who's coming on after you here. Oh, I'm having so much fun. You guys are so sweet. What a crew tonight. Okay, let's see. Removing dairy and gluten. Here we go. Removing dairy and gluten helps so much with your skin. Oh, great comment. So for those of you that were asking about acne, yes, going gluten-free and taking dairy out, you may find that really supports helping to get that gut working better because often gluten and dairy can be inflammatory. And that inflammatory response can sometimes cause your body to react. And acne or skin ailments, joint pains, and that can often be those symptoms that are going on in it. All right, we're going to go to our list again after I get down here to find more questions that are going on. Let's see. Is there a brand of, Fem, F-E-M, Femdophilus that you recommend? So that it, there you go, you got it. Good. Femdophilus is the brand. So you'll find it online, health food stores, probably some grocery stores might hold it if they have a natural food area. Okay, let's see. Are your lives saved anywhere? Yes, they're saved on Facebook at Natural Childbirth 101, so you can go back and you can look at them again. And I try each week to upload them into YouTube as well. And the YouTube has a slightly different name in the respect that it's natural and it's child and it's birth 101. So childbirth is broken up into 2 words. But I try to upload them up into there as well. Have you done a live on fertility yet? No, I don't think I have. I'll put that one on my list. Thanks for the recommendation. All right, let's see. Do you think taking EP at 35 weeks for first pregnancies is okay? EP, I'm assuming you mean evening primrose oil, EPO? And if so, yes. And hopefully that answered your question by the time I got to it. If not, you can ask me again. Came in late, but what is the best B12 and what is the best blue-green algae? Hey, I haven't mentioned blue-green algae yet, but I love blue-green algae. So I like Klamath Lake. Synergy is the one that I usually buy, but there are some others. But you want the blue-green algae that's from Klamath Lake. Do not get the ones that are actually spirulina and chlorella. They are more man-made, and I just love that Klamath Lake. It has all of the raw nutrients coming from the right sources, and I really feel like it gives you good raw nutrients in there. As far as B12, blue-green algae does have some B12 in it. It may not be enough if your diet maybe doesn't help as much with that. And your B12s, again, it can be Now, Source Naturals, Solar Ray, any of those brands that are more prominent at the health food store, those B12s. Even if you have a Trader Joe's, now some places aren't going to have Trader Joe's, but if you have Trader Joe's, they have a supplement, a B12 sublingual, that you can get from there. There's a ton of them online. There's so many that I'm not even sure I can tell you all the different brands, but those are some of them that you might look at. Okay. Let's see. I need something to help me with cholestasis of pregnancy. Oh yeah, if you've already been diagnosed with cholestasis, that one's tricky to back up. With the exception is if you will email me, okay, let's see, your email, sorry, that one dropped, let's see. Can you email me? Did that go in the right direction? That did not go in the right direction. Let's try this one. Nope, it is this one. If you email me at kalimjoy@gmail.com, okay? And you tell me that you have cholestasis, and you saw me on my live tonight, I will send you the cholestasis diet, and there are some supplements on that one. But we have had good results with things that have come up like that at getting those bile acids to reduce. And that, I think, is the main thing. If you can reduce the bile acids, meaning the body's able to handle the pregnancy until the birth can come, you're going to avoid having to have inductions, or hopefully avoid an induction